everybody. I'm Brianna. I'm here with Nurse Deck today. We are a site built for nurses by nurses with an aim to get everybody's voices heard. Today, I have Kim Delbo with me. Kim, you are one of those nurses that has done so much. I have notes here because there's so many things that you've done, and we're going to jump into a lot of these roles that you have. You're a nurse consultant, a mentor, you're a speaker, you focus on nurse innovation, culture change, translating evidence-based research into practice, and helping to eliminate disparities with vulnerable populations, especially underserved children, older adults, those that are socioeconomically disadvantaged. So a lot that's there, and a lot of topics that are top of mind for nurses right now. So I'm really excited to talk with you today. Thank you so much for giving us your time. We're going to run through some questions and then we'll kind of go from there. So
thank you so much for inviting me to be here with you today, Brianna.
Of course, yeah. So let's jump in. What are your thoughts on cost-effective healthcare? What are things that we can be doing to improve it? I know systems with healthcare right now is a big topic. So.
Absolutely. And what an awesome question to start off with, right? We know that our healthcare system is broken. We spend more on healthcare than any other developed country, but yet our outcomes are the poorest. And there's so much that we can do, right? To improve quality of care and just the cost of care in general. This is one of the reasons I believe where the IHI, the Institute for Healthcare Improvement, has included this very thing as one of the aims of the quadruple aim, among others that I'm sure we'll get to talking about today.
Yeah.
But in terms of I love population health, as my intro indicated. I have advanced specialization in education and community health nursing, which will always have a very special place in my heart. I'm really a upstream preventionist at heart. So when we look at the research over, decades of research, it has shown that for every dollar that we invest in prevention, we can realize a savings of, even greater than up to $13 in care delivery. So I believe that, there's a shift that's needed, right, in terms of caring for people where they live, learn, work, play, and pray, while addressing those social determinants of health. Evidence has also shown us that, our health is very much determined by these social determinants, so, the housing, the food, the transportation, and we really can impact, 80% of one's health is determined by social determinants. So how can we impact that more effectively? And I believe that really will require us to improve primary care and mental health services, that will have a tremendous or remarkable impact on improving the cost of care delivery. Also, I strongly believe in power. There's power in partnership and innovation. And a lot of people will always hear me say that because I really believe that's part of answering how do we correct the broken healthcare system. It's going to require us to, break down our silos, and really forge relationships, both through informal and formal partnerships, working across the care continuum to, really enhance healthcare, in general. So, it's really exciting times when some things aren't necessarily going well. It's a wonderful opportunity for us to capitalize and harness this disruption, this disruptive time that we're living in, to make improvement. Also, I think, we can't help but to say we have a fragmented healthcare system in many ways, right? Unnecessary duplication of care, medical care in general, which costs our healthcare system billions of dollars. And how could we better leverage technology to do this, right? So now, we know technology is an accelerator driver when it comes to translating evidence-based practice innovation research into evidence-based practice innovation. So I think we would be amiss if we do not mention leveraging technology as that accelerator driver in which it can help us realize tremendous outcomes. And then I think leadership, right? is a foundational. It's necessary. We have to have a new type of leadership moving forward to transform our healthcare system. I believe that we need to move beyond that traditional styles of, more linear leadership models where, it's like a top down
Yeah.
versus a systems approach to care delivery. And we need to move, in enhancing relationships and collaboration.
Yeah.
And that's what that new leadership style is going to do. So anyone in an organization can be a leader. And that's kind of what we promote with Radiant and Resilient Leadership. So,
Yeah.
yeah.
I
So
love that. I think that is such an important point, because we look at healthcare as this giant entity that how in the world are we going to fix this? And of course, it has to come through collaboration, like you said, but the relationships that we have, the people that are around us, are the people that we have the greatest influence over. And I also love how you're talking about the social determinant of healthcare. And of course, as nurses, we can all relate to how important prevention is, from a cost savings perspective, but also just a suffering savings perspective. And how much nurses can really, that's our language. We can really speak to people about preventative healthcare. So that's the lane that we can stay in when you feel like healthcare is such a big looming problem. And also how important it is that you mentioned that before a person, we have such a bootstraps mentality in this country that you have so much control over your destiny, but really the situations that you're born into, that you live in, really do determine your health. And why it's so important for us to fix the systems of healthcare. So thank you for bringing up all those awesome points. I'm like cheering you on.
Hey, we can talk all day about that point.
Yeah.
You just said so much right there. And nurses are so geared to, being able to help fix this problem that we're facing, these problems that we're facing. So we'll if we leverage them effectively, I'm sure we can make a tremendous difference.
Yes. As far as platforms like us, NurseDeck, talking about reaching out and touching the person next to you to start a movement to help with some of these problems, nurses that are joining NurseDeck, what do you think they can get out of a virtual community like ours?
Yeah, so I love what you're doing at NurseDeck, and just kudos to you folks there for the vision to start such a platform, and that fosters the spirit of community and connection for everyone, right? You include students in it from the very beginning, which I love. As a nurse educator in academia, I love that. And then those that are currently in the field or those that have been retired from the field. So you really thought of everyone when you thought about your target audience and who you're going to reach out to. But also, I just love the fact that, you're giving them the resources, the guidance, the mentorship, and the voice that they need to be able to make a difference and to grow within their profession. I think one thing nurses do really well is we are lifelong learners, many of us, and we're looking to grow and thrive where we're at. But we also want to make a difference, and that's the reason why we many of us join the profession of nursing, right? So I love, specifically the mentorship that you bring to the table. Mentorship is important at every level of nursing. So this platform, I foresee it really allowing nurses to find the guidance that they need to help them where they're at in their nursing journey, and connect them with the other professionals that can give them advice and support in the process. So,
yeah.
Great. You're doing great.
You spoke about mentors just now, and we're huge on mentorships. Why did you want to become a mentor? Why was that important to you?
Yeah, so I became a mentor because I find great joy in seeing others reach their goals and dreams that they never dreamed were possible. As a result, it often can change their entire lives, and I've seen this occur. In some of my previous roles, and even in my existing role, one of my existing roles, because I have several. It would it really is focusing on empowering them, and seeing some of them are even coming from lower socioeconomic levels into nursing school,
Mhm.
and then as a result they're getting a career in nursing, and you're seeing them then being able to buy a new home, and some of them are single moms, and so it helps them in terms of their entire family unit address their own social determinants in their household. So we sometimes take TANF population of students and then see them thrive, and that just brings it's so fulfilling to see
Yeah.
that occur. And then in the process, what are they doing? They're helping society by providing quality care. So it's a win-win-win, a win for the student, a win for the society in general, and the organizations in which they're employed at. So I find it very fulfilling, mentorship in general. But I think why I'm so drawn to mentorship is truly, it's an affair of the heart.
Mhm.
Uh,
Love
it's a
that.
connection, and it really can benefit everyone, right? It
Yeah.
benefits organizations, benefits mentors and
Mhm.
mentees, all of them. So, like from an organizational standpoint, mentorship has proven to, enhance loyalty between employees and
Yeah.
employers. It helps to decrease absenteeism, promote retention, and diversity,
Mhm.
and also helps people to acclimate to their roles and grow within that organization
Yeah.
to enhance their performance. And that's just at the organizational level. But
Yeah.
when you look at it from a mentor level,
Mhm.
the person that's doing the mentoring, it's beneficial to them. It's fulfilling to be able to make a difference.
Yeah.
In a profession,
Right.
and also in the lives of other humans. So
Yeah.
I don't think that there's a greater calling,
Yeah.
or a greater reward than to be able to do that. So, and it allows you to, kind of give back to others that have given to you in the past. It helps, improve your communication skills.
Mhm.
Also, there's many benefits. I could talk about this for a long time. Creating allies in the profession and networking, and enhancing values.
Mhm.
But then for the mentee, what are we looking at for the mentee, right? This is going to increase their confidence. It's going to help with professional development in the
Mhm.
mentee, you know, just in general, their recognition of their skill development,
Yeah.
and acquisition of skills in general. But it also, just provides that connection,
Mhm.
which we so desperately need, because sometimes, we're living in the midst of COVID pandemic,
Mhm.
but this is also a social isolation and loneliness
Yes.
epidemic
Yes.
in which we're living. And this was long before COVID even hit.
Yes.
I was pursuing my DNP, my doctorate, and had done a lot of work with looking at social isolation and loneliness epidemic, and then COVID hit, and
Mm.
leveraging technology during that time to address that
Right.
in innovative ways. But really, I think that we really need to promote relationships. So that's
Yes.
what mentorship does, and it's a
Yeah.
beautiful thing, beautiful process.
Yeah. I hear in what you're saying that mentors are anchors for our profession, and
Mm,
they really a time when we need new nurses to come up and stay and not be scared away, because it is just crazy out there for bedside nursing right now, and the emotional load that they're under. And I think having a mentor, even if they've never been through a pandemic before, they can still offer some guidance of how to get through tough times when you feel like you're drowning at work, and not getting ahead and not helping people, and all the reasons you wanted to become a nurse and not being able to do that professionally. I've not been at the bedside for a number of years now, but my heart just goes out to those nurses, because I'm like, God, you have a bad shift every once in a while, and that takes such a
mm,
toll on you. And to have that day after day after day, imagine having a strong
mm.
mentor in your life that could just give you that little bit of foundation and a touchstone to get through and to come back the next shift.
Yeah.
So I think that it's a priceless relationship, and a lot of times something that nurses don't get from nursing school. You're sort of just turned loose and good luck. And I wish that, at least in my school, unless you stumble across like a really great preceptorship, there's no formal mentorship
Mm.
situations that you're put into unless your hospital happens to promote it or your organization. So I love everything that you just said with that. And I agree 1,000,000% about the importance of it. Speaking of COVID, how do you feel about the treatment of nurses, health professionals? I feel like we had our big hero moment and then it's gone up. It's been a roller coaster. What are your thoughts about that, of what nurses and health professionals have gone through?
Yeah, so Brianna, I think that this is what really strikes a chord with me. This question that you posed, it's so disheartening to see this occurring. Sadly, have the privilege of networking with nurses across the globe, and they've indicated that they feel less valued, less disrespected, unappreciated. They're exhausted emotionally and physically, mentally, holistically exhausted. Can use it that way. Usually we talk about holistic health, but they're just really worn out, and they're suffering from moral injury, burnout, mental health problems, and they're deciding to leave the bedside in droves. And it's a scary thing for our healthcare system in general. I mean, one of my colleagues, Aaliyah Aaron, I'll put a shout out to Aaliyah out there, but she runs Nursing Innovation Hub, and she's the CEO with that. And she put something out on LinkedIn and said, could you imagine a healthcare system without nurses? I mean, what would happen? It would close the doors, right? So, we need to think about that, because what impact is that going to have on our overall society? This is going to have an impact, COVID-19, and not just on nurses, although I know we're focusing on nurses specifically today, but on everyone, because it's, this is a serious thing that we need to be, proactive in thinking about. And that's why I love what Nurse Deck has the potential of doing here. But we're dealing with this public health crisis, a nursing shortage crisis, which is translated into a public health crisis, and then seeing things that we never had to deal with in the history of nursing. High patient acuity, high volumes. We're dealing with virus on every end, and now wave after wave after wave. It's exhausting for these poor nurses and healthcare professionals, across the continuum. And as a result, they're leaving, and this is going to impact care delivery. When we look at a national survey, I read the statistics too, that was completed not too long ago, and it said that nurses were reporting that they're, worried about going to work, worried about how they're going to be treated. 56% said that they had reported a manifestations of the inability to concentrate. So it's impacting their mental health in many ways, and that they felt that they couldn't. There was stigma in the workplace in reporting these things. So, creating psychologically safe work environments that are going to destigmatize healthcare, mental health, is really going to be necessary moving forward to address these issues that we're facing subsequently as a result of COVID-19 and the social isolation, loneliness epidemic at the same time.
Yeah. I 1,000% agree. I think it's going to be a subject that people are going to be talking about for decades to come. And hopefully it'll be a turning point where mental, distress is something that we can voice and talk about and have it not be stigmatized, like you said. So my crystal ball that I look into every day, that's where I'm hoping it's going. But, it's a huge, huge problem. And it's going to have a breaking point. Like you said, imagine a world without nurses. You don't have one in terms of healthcare delivery. So that sort of leads into our next question, the current working conditions for nurses. I think the hot topic in the beginning was like no PPE, and everybody's struggling and scrambling, and ventilators, and where do we put people, and how is this transmitted? And I think a lot of those questions have been answered, and those issues have been addressed somewhat. But the current working conditions, like you said, is more of like this, God, you used a great term. I should have written it down. Like the not compassion fatigue, but
moral injury.
Similar. Yes. Moral injury. Yes. Yeah. Like the existential Ah,
Potential. I got you.
yes.
Yeah, in terms of our working conditions for nurses, we need to bolster that, right? The work environments in general that we're working in, they have to be improved. The state of health among nurses before COVID-19 was not good,
Yeah,
and then we threw on COVID. I mean, we had 50% burned out before COVID-19
right.
even hit, and now we're and this goes for physicians as well,
Mm,
and other healthcare professionals. So then we throw on a pandemic. um, you know, we have to do something. So it all starts with a creating and fostering, and this is why leadership is so important, a
mhm.
positive, professional, healthy workplace environment.
Yeah.
So I've had the privilege of doing a lot of research in that area, and that's kind of another reason why I decided to launch. Even before COVID hit, Radiant and Resilient Leadership in an effort to try and address and promote positive professional workplace environments. So
Mm,
there's a lot of work we can do in this space, and a lot of organizations that really need this work to be done.
yeah.
Assessing the problem first and foremost, and acknowledging it, and then working as a team interprofessionally, collaboratively,
Mhm.
and harnessing the bolstering the leadership pipeline in the process is going to be necessary for workforce development in general to occur. So, this is going to include structural empowerment on all levels, providing them the resources and professional development that they need
Yeah,
to step up and really rise
yeah.
through this situation. And there's opportunity, and that's what resilience, organizational resilience is all about. Helping organizations as a whole come up and be more resilient,
Yeah,
bounce back after this crisis. So
right.
there's a lot of work we can do, and helping organizations do this while measuring the return on investment.
Mhm.
There is return on investment with doing this. It doesn't cost a whole lot of money,
Right.
so it's a no-brainer,
Yeah.
if I can use that term.
Any way you look at it, yeah.
Any way you look at it, exactly. So, helping people, promote well-being in the organizations themselves, and doing that to foster resilience through this
Yeah,
crisis
yeah.
and leadership. So,
Right. I think, at least in my experience, so many nurses, you sort of get thrust into leadership roles like, surprise, you're the charge nurse today. You've only been nursing 6 months. Well, now's your moment to make sure nothing bad happens, So I think that leaders are made in nursing. And I think this pandemic is producing a lot of leaders, even if they don't realize it's happening right now. And
Mhm.
I just really hope, like you said, we have the people and the leaders in place now in administration that can pull those nurses up and really help them, like you said, with self-development, not just to have the resilience piece, like withstand everything they've gone through, but I like the radiance piece that you have there too. That just makes me think of giving them a chance to really thrive, because they will bring others with them.
Mhm.
um,
Yes.
and I think that is one silver lining that could come out of this, is we're building really strong leaders. They may just not know it right now, and if we can just get them through this, I think we might have a chance at really doing some good within the healthcare system, which will ultimately benefit everybody.
Yes.
So
Yes, Brianna.
I love that you have an organization that looks at that from a multifaceted approach. So that's
Well,
great.
thank you.
um,
I love the work that we were able to do. It's truly an honor to work with organizations to
I bet.
accomplish great work, and transform organizations in the process.
Right.
That translates into retention, recruitment, role socialization, which is a hot topic right now,
Yeah.
because we need nurses,
Yeah.
and not just nurses, but again, this affects everyone.
Yeah.
You impact nurses, that's a large chunk, right? So this has an impact on everyone, and that's about culture, and that's all leadership. So,
Yes. Yes.
and building relationships
Yes.
across the healthcare team. So,
Totally, totally agree. I love that. Speaking about nursing and leaderships, what do you think are some ways that nurses can start advocating for themselves if they feel like the leadership is lacking where they are? Are there things that they can start doing to advocate for themselves?
absolutely. And I think we need to recognize the power that we have And that starts with our voices, right?
Mhm.
We all have a voice, and that's not something someone can take away from us
Yeah.
or someone can give us. That's something we have to acknowledge for ourselves and
Yeah.
become active. Become active on social media, at your organization, build your network.
Mhm.
Speak up. Speak
Yeah.
up and don't be afraid to say the things that are hard to say.
Yeah.
Sometimes we have to, you have to say that the elephant's in the room, right? Before you can
Mhm.
address it.
Mhm.
So, saying it, but then when you do say it, you're focusing on solutions.
Yes.
And I think that's something that nurses can do really, really well. We focus on that evaluation and bring in those implementations in terms of the nursing
Mhm.
process and
Yeah.
clinical decision making and how we can leverage that there. But focusing on solutions to these public health problems that we're dealing with within our society, and that even includes how we're treated, and speaking up when things are not right, that
Mhm.
they are incivil, not just taking it and feeling like you have to be a doormat, but no, demanding that respect. And
Mhm.
um, you know we have to it starts with us.
Yeah.
So it really starts with us, and I think it comes down for taking a stand for what's right,
Mhm.
and capitalizing on some of the things that might be integrity, and how we treat others in the
Mhm.
process. Having those high moral standards for how we treat one another, and the
Mhm.
expectations to be treated in that same way.
Yeah.
So
Yeah, that's so true. It makes me think of that saying, "You teach others how to treat you," but
yes.
nurses 100% can benefit from living by that creed. Um, as far as nurse leaders, what makes a great nurse leader? Do you have any tips if someone has been put into a leadership position and they're looking to elevate themselves?
Absolutely. So, I think the number one thing is caring leadership. Truly caring for the people
Mhm.
that you're working with. Not losing sight that it's about the people.
Yeah,
Leadership is all about people. It's all about relationships, and doing so in a way that you are there to serve others.
yeah,
So it's harnessing humility in the process and humble servant leadership, but then also a culmination of authenticity and being real
mhm.
with like
Yes,
who you are, right? We're hearing a lot about authentic leadership now because I really believe that authentic leadership has the power to help
yeah,
us heal post COVID, and it's going to be
yeah,
necessary. And then also, working as transformational catalysts, with transformational leadership. So these new contemporary leadership models like authentic leadership, transformational leadership, quantum leadership, others, are really going to be needed,
yeah,
to make a great nurse leader. So giving them the power and the skills that they need to do that,
yeah,
bolstering their emotional intelligence, their ability to relate to people, and to demonstrate courage in the
yeah.
time of crisis. You know, as nursing, we know that we're already the voted the most trusted profession according to
Mhm.
Gallup, right? So
Yeah,
harnessing that trust for 2 decades, we've been doing that, right? Nearly 2 decades. But harnessing that trust, and that's what authentic leaders do to promote organizational resilience. Brianna, they
mhm.
really look at harnessing trust through relational transparency and
Mhm.
leveraging integrity and high moral standards to promote relationships within organizations, and
Yeah,
that's going to be needed to heal
yeah.
post COVID. And this has proven in the literature when you look at evidence-based research,
Mhm.
that it has been very effective in just really kind of helping to promote and address burnout in general.
Yeah,
But sadly, sometimes we shift away from being real with one another because it takes vulnerability.
yeah.
And sometimes leaders think that they have to have all the answers,
Right,
when the fact is actually that's contrary to the truth, right?
yeah,
We're never going to have all the answers.
right.
But that's why it's so important to be collaborative, and to really kind of harness more of a collaborative style in communication and dialogue, and building our teams and interacting with one another across the
Mhm.
continuum, even
Yeah,
as we're developing and fostering partnerships to really correct the
yeah,
issues that we're seeing. So
yeah.
yeah.
I love that piece you said about leaders being vulnerable. I think an honest answer sometimes from a leader to a nurse is, I don't know, but I'll find out. I mean, we're taught that in nursing school, and I think that never becomes untrue. And it's a very real point that anybody can relate to. But if you have someone that you believe them when they say, not only are we going to figure this out, but I need you, we're going to figure it out together. I mean, that's someone that you want to invest yourself in. You feel safe with them. And you'll follow them, you know?
Yes.
I think that's such a great point. And I think a lot of people, like you said, you have to put up a front, like being this big manager. And, you know, meanwhile, you're working in this hospital, you're passing by posters that say like, we care about you. But if you don't feel that from your leadership, like that just creates more of like the side eye distance, you know, like I'm just going to put my head down and do my own thing. But we are past the point of doing our own thing now. We need each other.
Absolutely. You know, you point out a wonderful thing. I love it. Perceived organizational support. You know, if you are not feeling it,
Yes.
right? You hit on it, right? We have to feel it.
Yeah.
And that's key. Organizations need to help their employees feel it.
Yeah.
And that's where the heart comes in, right?
Yes.
And the authenticity and building that trusting relationship. And that doesn't happen overnight. Hopefully the key is the goal would be to have the teams that are going to rise to the top through COVID are going to be those that had this pre-COVID, and then they helped them through COVID and then after COVID. But doesn't mean that they can't start. Like you can start at any time. So like building that ability to do those things and to really relate to your team members and to show support in meaningful ways to them, because they're the center of it. Like what to them, how do they define support? Right.
So them. Ask them.
Exactly. And then consistently over time, you know, meet that need. But it's a really, it's a conundrum, so to speak, in many ways, because in the same token, we have to protect the nurse leaders that are, you know, stepping up and into that role, because that can be quite exhausting as well. When you're giving of yourself 100% or 150% of the time, you know, and I fear for the nurse leaders out there that are really doing it well. You know, so there's importance in helping them to maintain self-care through the process. And I've lived through burnout myself, having served in a long-term care facility during COVID and supporting my husband in his role as a healthcare administrator there. And, you know, it was not easy. It was a difficult time, and it still is, you know, for many. So thankful, though, that we can make a difference in helping others to realize that they're not alone and that we're in this together.
Yeah, that's such all of those points. I couldn't agree more. And I think there will be some interesting research being done on this. And I think that's when leaders do have those vulnerable moments where they're, gosh, this is what my gut is telling me to do, but it's scary to do that and to realize that if you fail, you're failing a whole bunch of other people that are relying on you. But that's where that evidence-based research is so important, because you just have to rest back on it that, you know, the data is there. If we just follow the data, then we should be okay and lead from our heart, like you said, in the long run. I think that's great. In terms of safe workplaces for nurses, I think we've talked about like emotionally safe and mentally safe. What are some things that hospitals and clinics can do to create safe workplaces for nurses in whatever capacity that means to you?
Yeah, so I think it really starts with, I listened to a podcast by Daniel Goleman, and he's the father of emotional intelligence, right? And how to create highly basically high functioning teams by leveraging psychological safety in the workplace. So really, I think that's the start in leveraging psychological safety and promoting that at all levels of the organization with everyone. And then, you know, leaders are looking for tools to address mental health in the workplace, or promote health in the workplace and well-being. So providing those tools to the
Yeah.
leaders is key. And then, according to the NAMI, the National Alliance on Mental Illness,
Mm.
a lot of what I'm focusing on right now happens to be mental health. But we know that when we're caring for our people in healthcare organizations, we are caring for them holistically, right? So
Mhm.
physically, we're thinking
Yeah.
about tools for them to care for themselves physically. We're
Yeah.
thinking about emotionally, tools to care for them emotionally, which oftentimes leads into social and mental as well, right?
Mhm.
So we have tools for mental illness and mental
Yeah.
health promotion. And then also, spiritually,
Yeah.
and that, can tie into mindfulness and yoga and prayer in the
Right.
workplace, even. And, working as a team to do these things, so that we recognize that there's no one way to do it the right way.
Yeah.
So, brainstorming together of what your specific problems are,
Mhm.
identifying them. It's like assessing, right? We
Yeah.
assess the organization, we find out where they're at, and there's a plethora of reliable instruments to help to do this. So
Mhm.
using a reliable instrument to do this with a team, and then doing it, basically as an evidence-based practice project or
Yeah.
pilot, right?
Yeah.
In your organization, and then building off of this, and then iterating and going back and making these changes that you identify
Yeah.
as you come up with things. But the whole purpose in all of it is that we have basically a shared governance,
Yeah.
that people's voices are heard in the
Yeah.
process, because that's
Mhm.
going to increase that perceived emotional or perceived organizational support. So
Right.
that's really key in doing this the right way.
Yeah.
So I really that those are some of the ways I think that hospitals and clinics can do this effectively. There's
Right.
a lot of literature out there in regards to burnout and addressing burnout, and promoting healthy workplace environments, and that's really kind of what we need, people to be in there from an unbiased perspective, coming
Mhm.
alongside organizations and looking for ways to brainstorm solving their problems, and then implementing different interventions that are going to address those issues that
Yeah.
are identified in their evidence that we collect from the data. So again, following the data, right?
Yeah.
Beyond that, you said, so important. And then allowing people the permission to, just kind of speak openly, without fear and shame, and that's
Yeah.
that psychological safe work environment. So
Yeah. I couldn't agree more. I love how you framed it within the nursing assessment, framework. So I think that's so relatable to so many nurses. Kim, let me ask you, what do you think about organizations, hospitals that maybe at the beginning lost some of the trust with their employees, when they're the time when there was confusion, I mean, not really confusion, but mixed messages, I should say, about PPE, like, oh, you can only wear your N95 per patient. Well, now you can keep it in a little brown bag in your locker. And how do some of the organizations go about repairing that trust with their employees? I mean, and you understand from a legal point of view why they answered the way they did, but that doesn't help their nurses on the ground who are doing this work and putting their lives and their health at risk.
yeah.
Um, how do you think some repair work can be done with organizations like that?
Yeah, I think that's a great question. And I think that, again, it comes back to authenticity,
Yeah.
and being real. The fact is, we know that there was a surge. We know that the facts are there, and you acknowledge those facts as such. We know that there was, we had to optimize
Yeah.
PPE,
Right.
and we didn't know what was going to happen, the
Yeah.
unknown of
Yeah.
COVID. So, you make the best decision you can at that time,
Yeah.
with the information that you have. And that's basically what we did. And, we did what we were told too.
Yeah.
Hopefully they did what they were told, the organization, but assuming that they did, because I do like to give people the benefit of the doubt, right? Then, I, this is where we're at today. Things might change tomorrow.
Mhm.
Being open to them as you're going through it. Hopefully they did that. If they couldn't do it then, or they didn't do it then, and their lines of communication weren't, as clear,
Yeah.
as they could have been, then, recognizing that, we could have done it better.
Yeah.
How could we have improved upon this situation? I think that's one thing about healing anything, right, in
Mhm.
life,
Yeah.
is recognizing how you could have done it better.
Yeah.
And then verbalizing that to your team,
Yeah.
and taking ownership,
Mhm.
um, for anything that, you know, maybe wasn't done to the
Right.
best, putting the people first. So I think that's where it starts,
Yeah.
Brianna,
Yeah.
is really being real. And that's not going to be done without authentic relationships.
Yeah.
So,
100%.
and
Yeah, I
then,
think that's so important. Like you said, validating the concerns, even though it's an issue that's sort of gone and done, but it's still in the back of the mind for people that you're asking for their trust and continued
Mhm.
work. So I think, like you said, that putting that authentic spin on it, or not spin, but you know what I mean, that authentic um, conversation
Mhm.
and
Yeah, and asking them, how could we have
yeah,
done it better, right?
yes, yes,
From the bottom up, right? The systems-based
yes,
approach to healthcare improvement in general. Asking your team, how could we have done it better? Where
yeah,
did we fail you?
yeah,
And how do you feel about your existing leadership right now, or
yeah,
your organizational leadership? And then when you identify that, and identify that through identification of themes and the
yeah,
research or whatever it may be, you're then saying, okay, well, we're gonna own up to that
yeah,
part, and then say, let's fix this so it doesn't
yeah,
happen again, right?
right,
And then they feel a part of solving that problem within
right,
the organization, and that builds trust,
yeah,
because they're
right,
also you're applying what they're saying to you,
yeah,
and that's so important. And
right,
I hope organizations do that.
yeah,
Um,
me
if
too,
they don't, sadly, I think that it's not going to be good. It's not going to be good for the healthcare system.
right,
It's not going to be good for our population and our society in general,
yeah. And I think,
especially those most vulnerable.
yeah,
Um,
I think just empowering the voices of their nurses will go a long way to helping them invest back in, and chip away at some of the burnout that they're feeling.
mhm.
Um, Finally, how do you think nurse tech can help with these issues and these challenges that they're facing, that nurses are facing right now?
So I think, continue to do what you're doing, shining a light on the state of the broken healthcare system, and then shining a light on those that have a desire to fix it, is important. And just really kind of focusing on solutions and building relationships, is so important, and empowering people through professional development,
Hmm.
ways that they could. To grow as leaders. I mean, so I think that there's a great synergy, between us and just in general, what's needed in healthcare and meeting that need, to address and solve these problems that we're seeing,
Yeah,
many of the problems which we talked about today. So, I think that that's challenge. It is a challenge, but it's also an opportunity,
yes,
for us to come aside and help nurses
yeah,
thrive, and not just merely survive where they're at. And that might be empowering them with skills that are needed, to be better leaders. It might be, empowering them to think like innovators or entrepreneurs, or other
yeah,
ways outside of
yeah,
bedside nursing, even, to help them heal,
right,
from this crisis. So, kind of thinking outside of the box,
yeah.
and fostering partnership in the process, and leveraging that power that's there with partnership and innovation.
Yeah, I love that. I think you're 100% right. When things get broken open, there's one place you can go with it, which is to grow bigger and to heal. And like you said, the power in the partnership. I love that phrase. That is such a powerful phrase for nurses, because we're so teamwork driven, in general. So
We are.
um, great. Well, thank you. I'm loving everything we talked about today. It gives me hope for the profession. Tell us how people can learn more about your work. Do you have a website or anything that you'd like to share with our audience?
Of course. Yeah, feel free to look me up on LinkedIn. It's probably the best place you can reach me at. I'm pretty
Okay.
active. there. It's Kimberly Delbo. You can follow me there, and also Radiant and Resilient Leadership as
Okay.
well. It's kdelbo at rnrleadership.com. So if you need
Okay.
some R&R,
Yeah. I like that.
or just some Radiant and Resilient Leadership, look us up there, kdelbo at rnrleadership.com.
Awesome. That's great. I think it's such an important topic to discuss, because I think when nurses that are especially bedside right now and they think about administration and organization, they think of suits way up on the 55th floor that don't give a,
Yeah.
anything about what they're going through. And it's so nice to know that there's people out there that are really invested in the bedside nurse, that ultimately will help to heal the system of brokenness that we have right now, because we need everybody. So
Yes, we do. It's going to take a village, Brianna.
yeah.
Yeah, we all have a part to play.
Yeah. Awesome. Well, let's end there.
Yeah.
And thank you, Kim, so much for your time. It was so nice talking with you today.
And likewise, Brianna, thank you for inviting me.
Yeah. And we'll be seeing you on our nurse magazine coming up. So everybody stay tuned for that.
Okay, great.
All right. Thanks so much. Have a good one.
You too.